Imagine you're lying on a wooden table. Your leg is shattered. The bone is sticking through the skin. A man stands over you holding a blade. There is no anesthesia, no numbing gel, no injection to make the pain disappear. In a few seconds, that blade is going to cut into you, and you are going to feel every single second of it. This wasn't a nightmare. This was Tuesday for most of human history. So how did anyone survive surgery while being fully, horribly awake? Most people assume surgery is a modern invention, something that started with hospitals, machines, and sterile white rooms. But that's not true. Humans have been cutting into other humans for over 10,000 years. Skulls have been found with holes drilled straight through them, and the bone had healed, which means the patient didn't just survive the surgery. They lived for years afterward. So the real question isn't whether ancient surgery happened, it's how anyone endured it. Because here's the problem almost nobody thinks about. Pain isn't just uncomfortable, it's a defense mechanism. Your body is built to fight, flinch, and run away from anything that hurts this much. So step one of ancient surgery wasn't cutting. It was figuring out how to stop a screaming, thrashing human being from moving at all. And the first solution was brutally simple: strength. Pure physical force. Surgeons didn't work alone. They worked with assistants whose entire job was to pin the patient down. Arms held, legs held, sometimes an entire team of grown men holding one screaming person still, just long enough for the cut to be made. But holding someone down solves one problem. It creates a much bigger one. Because pain that's extreme doesn't just make people move, it can kill them outright. The body goes into shock. The heart can stop from the sheer trauma alone, before infection, before blood loss even becomes a factor. Which means the real enemy of ancient surgery wasn't the wound, it was time. Every second the patient stayed conscious was a second closer to their body simply shutting down. So surgeons developed an obsession that seems insane today: speed. The best surgeons in history weren't necessarily the most precise, they were the fastest. There are historical accounts of amputations completed in under 2 minutes, start to finish. Not because faster was better technique, because faster meant the patient might actually survive being awake for it. But speed alone wasn't enough, so humans searched for something else. Anything that could dull the pain even slightly. And that search led somewhere dangerous. Alcohol was one of the earliest tools. Get the patient as drunk as physically possible before the first cut. It didn't remove the pain, but it slowed reaction time, blurred panic, and made some patients pass out from the combination of fear and intoxication before the worst part even began. Opium was another path. Chewed, smoked, or dissolved into wine could dull the edges of consciousness, just enough to survive the ordeal. But here's the twist almost nobody expects. These weren't reliable solutions. They were gambles. Too little and the patient felt everything. Too much and the patient could stop breathing entirely and die from the cure before the surgeon even picked up the blade. So surgeons were walking a razor's edge between agony and death, with almost no way to know exactly where that edge was. And that led to an even darker solution: unconsciousness by force. Some historical accounts describe a precise blow to the head, timed to knock the patient cold out just before surgery began. It sounds almost unbelievable. But when your only tools are pain, fear, and desperation, knocking someone unconscious can look like mercy. Of course, that came with its own horrifying risk. Hit too hard, and the patient never wakes up at all. So picture the surgeon's actual dilemma. Every option in front of them was dangerous. Do nothing, and the patient might die from shock. Give too much alcohol or opium, and the patient might die from an overdose. Knock them out, and they might never open their eyes again. There was no safe path, only a slightly less deadly one. And yet, despite all of this, surgery didn't stop. Amputations happened. Tumors were removed. Babies were delivered through cesarean incisions. Broken bones were reset by hand while the patient screamed. Why would anyone choose to go through this? Because the alternative was worse. A gangrenous leg didn't just hurt, it killed, slowly, painfully, and certainly. A blocked, infected tooth could poison the entire bloodstream. An untreated tumor could grow until it ended a life anyway. So people made an impossible choice: a few unbearable minutes of pain now, or a slow, certain death later. And this is where the story shifts from horror into something else entirely: human ingenuity. Because surgeons weren't just brave, they became obsessive problem solvers, refining every single detail to shave down suffering wherever they could. They developed specific hand positions to immobilize limbs without extra assistance. They designed tools shaped specifically to reduce the number of cuts needed. They studied anatomy obsessively, not out of curiosity, but because every wasted second of imprecision meant more suffering for the person on the table. Some cultures developed something even more remarkable: compression techniques, pressing firmly on nerves near the surgical site to numb the area slightly before cutting, an early, imperfect ancestor of modern nerve blocks, discovered centuries before anyone understood what a nerve even was. Other healers turned to nature itself. Certain plants, when applied directly or ingested in careful doses, could numb tissue locally. Trial and error, generation after generation, slowly built a fragile map of what helped and what killed. Every discovery like this was paid in human suffering. Someone had to be the first person that plant was tested on. Someone had to survive, or not, for that knowledge to be passed forward. And that's the part of this story that rarely gets told. Every surgical technique we take completely for granted today exists because thousands of people endured unimaginable pain, so the next patient might endure slightly less. This wasn't just medicine. It was an unbroken chain of sacrifice, stretching back thousands of years. Each generation inching closer to relief the next generation would finally receive. It took until the mid-1800s for real anesthesia to arrive. Ether, then chloroform, changing surgery forever almost overnight. Before that moment, every single surgery in human history was some version of the nightmare you imagined at the very beginning of this video. Full consciousness, full sensation, full awareness of the blade. And somehow, humans didn't just endure it. They pushed forward anyway, refining, testing, surviving, and passing down whatever they learned. Every operation performed under full sedation today is standing on top of that history. Every surgeon who has never once had to knock a patient unconscious with a blow to the head owes something to the ones who did. The next time you hear the words, "You'll be asleep for the procedure," remember what that sentence actually replaced. Not comfort, not convenience. Thousands of years of humans choosing to suffer through the unbearable, simply so the person after them might suffer a little less.